Notice: the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Ganser syndrome, also known as prison psychosis, hysterical pseudo-dementia, or balderdash syndrome, is a rare and enigmatic psychological disorder. It is classified as a dissociative disorder and is often considered a reaction to extreme stress. This syndrome is characterized by nonsensical or inappropriate responses to questions, clouded consciousness, and other dissociative symptoms, such as amnesia or fugue states. The most striking feature of Ganser syndrome is vorbeireden, or talking past the point, where answers given are either slightly wrong or completely unrelated to the question asked. Historical context: Ganser syndrome was first described by the German psychiatrist Sigbert Ganser in 1897. Ganser observed the syndrome in prisoners awaiting trial and hypothesized that it was a form of hysterical disorder. Initially, it was thought to be an attempt to escape the harsh realities of prison life or avoid criminal responsibility. However, later studies indicated that Ganser syndrome could occur in various stressful environments, not just in prisons. Clinical features: the central feature of Ganser syndrome is vorbeireden. For example, when asked simple questions like, "What day is it today?" the patient may answer purple or 25 o'clock. Patients may exhibit other symptoms like hallucinations, clouding of consciousness, somatic conversion symptoms, and memory loss. They may also show a pseudo-dementia appearance, where their cognitive impairment seems severe but is inconsistent and non-progressive. Interestingly, despite their apparent confusion, patients with Ganser syndrome often avoid harming themselves or others, indicating some level of awareness. Pathogenesis and diagnosis: the exact cause of Ganser syndrome remains unclear. It has been linked to psychological stress and trauma, but biological factors might also play a role. Differential diagnosis is crucial, as the syndrome can mimic other psychiatric conditions like malingering factitious disorders, schizophrenia, and mood disorders. Diagnosis is primarily clinical and relies on observing the patient's symptoms and ruling out other disorders. Treatment and prognosis: treatment for Ganser syndrome typically involves a combination of psychotherapy and medication. Psychotherapy aims to address the underlying stress or trauma, while medications like antidepressants or antipsychotics may be used to manage specific symptoms. The prognosis for Ganser syndrome is generally good, especially if the underlying stressor can be resolved. Most patients recover fully with treatment, although some may experience a relapse, particularly if re-exposed to severe stress. Controversies and current research: Ganser syndrome is a subject of ongoing debate within the psychiatric community. Some experts question its classification as a distinct syndrome, suggesting it may be better understood as a symptom of other psychiatric disorders. Current research focuses on better understanding the syndrome's pathogenesis and effective treatment strategies. There is also interest in exploring the relationship between Ganser syndrome and other dissociative disorders to gain a deeper understanding of how the human mind reacts to extreme stress. In conclusion, Ganser syndrome is a rare and complex psychiatric disorder that manifests as a dissociative reaction to stress. Its hallmark symptom of giving approximate answers highlights the intriguing ways in which the mind can respond to overwhelming situations. Understanding and effectively treating Ganser syndrome remains a challenge, reflecting the broader complexities of diagnosing and managing mental health conditions. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.